Hi, I'm Dr. Behnaz. If you've ever had a little urine leak out when you laugh, sneeze, jump, or lifting something, then you might be dealing with stress urinary incontinence. And while it may feel frustrating or even embarrassing, I want you to know you're not alone, and this is something we can treat. So let's break it down clearly so you can understand exactly what's going on in your body and how we can help it heal. What's stress incontinence? Stress incontinence is a type of leakage that happens when there is pressure on your bladder, like during a cough or jump or a laugh. It's called a stress not because you're emotionally stressed, but because of physical stress or pressure. Now picture your bladder like a balloon, the pelvic floor muscles located under it, holding it up. When those muscles are strong and responsive, they keep everything close. But if those muscles are weak, delayed, or not working in sync, pressure from above, like a sneeze, can push urine out before you're ready. Why does this happen? There are a few reasons. Muscle weakness, especially after childbirth or surgery, lack of coordination. Your muscles may not activate fast enough or at the right moment. And hormonal shifts, like during menopause, lower estrogen levels make the tissue softer and less supportive. And also increased abdominal pressure when people push down with their belly muscles during lifting or movement puts extra force on the bladder. If the pelvic floor doesn't lift in response, leakage can happen. What do we do in pelvic floor therapy? We always start with a thorough assessment. We talk about your daily routine and what causes leaks. We check your pelvic floor muscles, how strong they are, how fast they respond, and whether they're coordinated with your breathing. We also watch how you move. Do you hold your breath when you lift? Do your glutes or abs take over? So, step one is finding the right muscle. We use cues like try to stop the flow of urine, but don't actually practice on the toilet. Lift the base of your body inward and upward gently. This isn't about squeezing your thighs or clenching your butts. It's a deep internal lift. You start in gravity-reduced positions, like lying down or on your side, where the bladder isn't being pushed down as hard. This makes it easier to learn and connect. So, next, we teach something called the neck technique. It's a simple and powerful. You gently contract your pelvic floor just before a sneeze, lift, or laugh. That preemptive lift protects the bladder before the pressure even hits. As you improve, we progress your training from lying down to sitting, standing, walking, squatting. We retrain your body to handle real-life movements while keeping control. We use functional drills like stair-stepping, lifting, laundry, or reaching overhead. This makes the training directly applied to your daily life. And about hormonal considerations, for people in menopause and postpartum, we also adapt your plan. Tissues might be more sensitive or thin. Strength may take more time to build. Coordination can change after birth or with hormonal drops. But don't worry, we meet your body where it is and progress it step by step. So let me bring you a real life story. A woman in her 50s came to me after she started leaking during her workouts. She was doing sit-ups and jumping ropes, things she had done for years. She thought maybe she was just getting older. But we found her pelvic floor wasn't activating at the right time. She was holding her breath during effort. She was overusing her abdominal muscles and pushing down. Over several sessions, we taught her how to exhale while lifting, how to lift the pelvic floor with control, and how to use the neck technique during exercise. In just a few weeks, her symptoms improved, and by 2 months, she was back to her regular workout without leaking. Stress incontinence is common but not permanent. It's not just about strength, it's about timing and coordination. Breath, posture, and movement matter. With the right plan, you can get dry, strong, and confident again. So, in our next video, we'll dive into urge incontinence, that sudden, intense need to go, that's hard to hold back. So I'll guide you through calming your bladder and regaining control. Until then, stay hopeful and remember, you're not broken. You're just ready for the right kind of care.